I'm Angela Springer.
And I'm Chloe Klauser.
And we're licensed midwives with Natural Birth at Home. This video is all about risks and emergencies.
Yeah, well, in South Carolina, to have a home birth, you have to be low risk. So a lot of the things that we hear in hospital settings don't always apply to us because we are always checking during prenatals to make sure that you are staying low risk to have a home delivery safely. We also do a lot of counseling and review of supplements and things like that. We're always looking for little yellow flags during your pregnancy and seeing what we can do to try and get you back on track to keep you low risk.
Yeah, exactly. So let's say something does come up while you're pregnant. What happens? Well, if we can't cure whatever's going on with the nutrition and supplements, we might refer you to some of our trusted physicians to see if there's something else that we can do. But sometimes ultimately home birth is not right for everyone. So if we have to, we'll transfer your care to a higher level provider. That means that we'll send your records, we'll figure out the financial situation between us, and you'll transfer care. We'll no longer be your midwives, and you'll plan a hospital birth with your new provider. Reasons that might happen would be things like high blood pressure, gestational diabetes that you can't control with nutrition, you need medication. Maybe your baby is not growing correctly, too small, or maybe something else is going on. Or the most common kind of thing that pops up unexpectedly would be something like preeclampsia, which is very serious and needs to be dealt with at a hospital.
Yeah, absolutely. And then we can also discuss what a transfer might look like in the birth setting. So say your pregnancy stays low risk and you get to the labor and delivery portion, and we're still assessing you and baby during the entire labor.
Right.
And say we see something, a little yellow flag. Again, we're not waiting for red flags, we're looking for these yellow flags because we want what's best for you and your baby. So this could include if baby's heart rate is a little too high, or if you develop a fever, or say unfortunately your water's been broken too long. There's a lot of different reasons that could come up that it would be best for you to deliver in the hospital. But with that, we try to make that transition as seamless as possible. Most of the time, we have a 10% transfer rate, and most of the time it is for pain management after a long and tiring labor. And our C-section rate is 5%.
Yeah. So it doesn't happen often, but when it happens, we're glad that we have great places to transfer to. A lot of times people are worried more about the true emergencies though, and the truth of the matter is we don't really have time to transfer in the case of a lot of true emergencies. These would be things that you might have heard about, like shoulder dystocia or a postpartum hemorrhage, or what if your baby needs to be resuscitated? Well, guess what? We're trained in all of that. So we are trained to handle birth emergencies in the home setting. We carry the equipment and medications that we need just in case for those reasons, because time is of the essence, and that's what you hire us for. We're there to make sure that you and your baby are safe, even in the event of an emergency.
And the even rarer one would be a transfer postpartum. So say you were to bleed too much, or maybe your baby is showing signs of infection, or you are. We're always monitoring you guys to make sure that you are still healthy and safe after delivery. But if there is a reason to transfer postpartum, we will make sure you get where you need to be.
That's right. And then we're always available to help you, navigate through that. We don't drop you off at a hospital and run away. We come in, we get you settled, we make sure everything's good, that there's a plan of care. We have a proper transfer of care, including sending records and answering whatever questions we might need to do, give report. And then we're available for you after the fact. You can still reach out. We can still come back and do postpartum visits in your home in the event of transfer at that point. But we definitely want to make sure that you and your baby are safe at all times.
Absolutely.